talked about fungal infections. Now the last group of diseases are from viruses or viral infections. These are HPV, herpes, and HIV. We'll talk about next semester, but HPV and herpes. So, HPV, human papilloma virus, HPV, human papilloma virus, yeah. So, HPV can cause verruca vulgaris, condyloma acuminatum, and Hex disease. And then you have herpes. Herpes can cause herpes simplex 1 and 2, varicella zoster virus, Epstein-Barr, and Coxsackie virus, viral infections. Now, important fact, what number of HPV is the one associated with oral cancer? HPV 16 is the one associated with oral cancer. And heavy smokers that drink a lot of alcohol can be at high risk for the oral cancer. Side note, alcohol is not a risk factor, but it does dry out the mouth, so that's why it's included. Okay, but remember, HPV virus causes certain infections, so now we're going to go over the 3 infections that can be caused from HPV virus. So, HPV verruca vulgaris. This is the wart. It's a traditional standard wart. It's transmitted through auto-inoculation, which means it's direct contact from your skin to skin or mouth to skin. The lips can be the primary area. It's just basically seen as a white, papillary, firm, exophytic lesion, just a round wart. And the treatment for this is just to remove it. And then you can have HPV condyloma acuminatum, and this is genital warts. So, verruca vulgaris is a regular traditional wart. You can remember that from Charlie and the Chocolate Factory when they say verruca, because they called her a wart in the movie. So she's a traditional wart. And then you have condyloma acuminatum, and that is genital warts. And that is caused by several HPV human papilloma viruses. Basically, this one's only transmitted through sexual conduct or auto-inoculation of saliva, semen, or blood. It can occur in the mouth. You can have genital warts in the mouth. Basically, these lesions or these warts are not keratinized, so they're pink and soft. They're not hard and round like the traditional warts. And the way to treat these is to also remove them. So then you can have papillomas, which is HPV related, transmitted orally, and we'll talk about that later. So the last HPV viral infectious disease is Hex disease, or also known as focal epithelial hyperplasia, Hex disease. This is characterized by seeing a lot of whitish or pale pink nodules, and they are distributed throughout the oral mucosa. They're most common in the lips and the buccal mucosa area. They can be common in children, and not really common in white people. The lesions are generally asymptomatic, they don't hurt, and they don't require treatment, and they go away on their own. Hex disease. So, which HPV human papillomavirus number causes this infection, causes Hex disease? It's 13. So just think of 13 being an unlucky number, and it's related to heck or to hell. That's Hex disease, HPV 13 infection. That's what it looks like in the mouth. Remember, it's whitish to light pink little nodules grouped together, and it's on the lips and oral buccal mucosa usually. Alright, now we have herpes simplex. You have herpes 1 and 2. Herpes 1 is happening in the oral cavity and above the belt. Herpes 2 is genital region. Herpes simplex is one of the groups of viruses called human herpes viruses, HHV. So you can have primary herpetic gingivostomatitis. This is an oral disease caused by an initial infection with the herpes simplex virus. Basically, it's painful red and swollen gingiva with lots of vesicles on the perioral skin. and the vermilion border of the lips and the oral mucosa. The vesicles start to progress and form ulcers. Patient can have fever, tiredness, cervical lymphadenopathy, which is swelling of the lymph nodes or the cervical region. Primary herpetic gingivostomatitis usually occurs in children between 6 months to 6 years, and parents usually aren't aware of it. They think the kid is just teething. So the majority of these infections are thought to be subclinical, which means the host is not aware that it's happening. This is what it looks like. Little vesicles that begin to erupt on the lips, perioral skin, oral mucosa, the tongue too. And then you can have a recurrent herpes simplex infection. This is when the virus persists in a latent stage. Usually it is in the nerve tissue of the trigeminal ganglion. It's estimated that 1/3 to 1/2 of the U.S. population experiences recurrent herpes simplex infection. 95% of people have been exposed to herpes simplex, which is like cold sores and stuff. So the most common area for recurrent infection is on the lips, and it's also known as herpes labialis. This is also called a cold sore or a fever blister. You can have these occur due to stress, sunlight, wind, menstruation, fever, emotional stress, fatigue, etc. So there's a cold sore for you. Cold sores can occur in the mouth on keratinized mucosa that's attached to bone. Painful groups of small vesicles that ulcerate and coalesce to form a single ulcer with an irregular border. Patient can have a prodromal period with symptoms such as pain, burning, or tingling. Cold sores are transmitted by direct contact with the infection. The primary infection occurs at the site of inoculation. So the primary infection happens wherever you're touched with the virus. And the amount of virus is in its highest at the vesicle stage. That's why when you have a patient come in and they have a cold sore or a little vesicle, we don't want to see them because that's when the virus is highest. There it is in the mouth, tiny vesicles in the mouth. You can have a herpetic whitlow. This is also a form of recurrent herpes simplex. This is a painful infection on the fingers due to a primary or secondary infection. So basically, the cold sore can be transferred to your fingers or your eyes, and when it is transferred, it's called herpetic whitlow. So we want to review the differences between aphthous ulcers and herpes. Aphthous ulcers are on movable, non-keratinized tissue. Herpes is on keratinized tissue. Aphthous ulcers can form as one to several, but they're usually divided. And herpes are multiple areas, multiple lesions in an area. Minor aphthous ulcers, vesicle does not turn into ulcers. Herpes, the vesicle does turn into the ulcer. Both are painful. Minor aphthous ulcers are less than 1 centimeter. Herpes are 1 to 2 millimeters. And they both can be recurrent. So how do you treat recurrent herpes simplex? You need antiviral drugs because, again, this is a viral issue. But these drugs have not been shown to be consistently effective in treating lesions. What are some over-the-counter drugs that you can take for cold sores? You can take Abreva, stuff like that. Okay, so the next virus is varicella zoster, and this is also known as chickenpox. It's chickenpox, which is varicella, and herpes zoster, which is shingles. So this is contracted when respiratory aerosols and contact with secretions from the skin lesions. This is how you get the virus. You can breathe it in, or you can touch ulcers on someone else, the lesions on someone else. So chickenpox is highly contagious. It contains vesicular vesicular and pustular eruptions of skin and in the mouth. Systemically, it'll be a headache, fever, and tiredness. And why does it usually occur in children? Because children pass it along so easily. So there's chickenpox on the face, and then chickenpox in the mouth. And then herpes zoster, which is also known as shingles, is the secondary form of chickenpox, and it occurs in adults. It's characterized by unilateral painful eruption of vesicles due to whatever nerve it's distributed on. So basically, when you see someone with shingles, you're going to see painful areas of vesicles on one side of the body only, and that's because it has to do with the nerve that's affected by the virus. And our nerves can go from just one side of the body. Any branch of the trigeminal nerve may be involved if the lesions are affecting the face, because we know the trigeminal nerve goes across the face. Vesicles are often preceded by pain or burning or paresthesia, and the disease usually lasts for several weeks. But the neural pain may take months to be fixed. So here's an example. Again, shingles, herpes zoster is going to be seen on half the body. And there it is in the mouth. So how do you diagnose it and treat it? Well, basically, diagnosis is generally made on clinical features, but you can also biopsy it to make sure it's not herpes simplex infection, because it can look similar. But varicella treatment, or chickenpox, is palliative. Basically, it just has to go away on its own, so you just treat the patient to make them comfortable. But you will use antiviral drugs for immunocompromised patients and for patients with the zoster virus, because they need help getting rid of the virus. Okay, Epstein-Barr. Epstein-Barr infections, virus infections, cause many diseases. They can be infectious mononucleosis and hairy leukoplakia. Hairy leukoplakia is not to be confused with black hairy tongue, by the way. Hairy leukoplakia is associated with HIV. Okay, infectious mononucleosis. This virus is basically mono. It's characterized by sore throat, fever, generalized lymphadenopathy, which is enlarged lymph nodes, tiredness and fatigue. White spots may appear on the palate. In the United States, infectious mononucleosis occurs among teens and young adults, and it's known as the kissing disease. Then you have hairy leukoplakia. This is an irregular corrugated white lesion, most commonly occurring on the lateral border of the tongue. So the Epstein-Barr virus is considered the virus that causes hairy leukoplakia, and it occurs in patients who are infected with HIV. But it also can be reported in patients that are not infected with HIV. So there it is again. It's a corrugated irregular white lesion on the base of the tongue, or side of the tongue. Hairy leukoplakia. And then you have Coxsackie virus infections. And this virus causes several infections as well. It causes herpangina and hand, foot, and mouth disease. So Coxsackie virus can be transmitted from fecal oral contamination, saliva, and respiratory droplets. So herpangina is characterized by fever, sore throat, tiredness, and dysphagia, or inability to swallow. It includes vesicles on the soft palate, and you'll see a red pharynx. It resolves in less than 1 week without treatment. So basically, herpangina is redness in the mouth. It's a complete systemic feeling. And then you can have hand, foot, and mouth disease. It usually occurs in children less than 5 years old because it transfers really easily. But basically, it's multiple macules or papules on the skin, feet, hands and toes, and fingers. Oral lesions are painful vesicles that occur anywhere in the mouth. So you can see it in the mouth, on the hands, on the feet, and it's just a virus from Epstein-Barr. So how do you diagnose hand, foot, and mouth? Because it can be confused with primary gingivostomatitis. Well, the skin lesions differentiate the herpes simplex infection. Treatment isn't really required, it kind of goes away on its own. There's examples of it, little vesicles. And then other viral infections can cause symptoms in the mouth. So these ones that usually don't start in the mouth but can be seen in the mouth are measles and mumps. Measles is caused by paramaxiovirus, and it's highly contagious. It's a skin rash. You'll see Koplik spots in the oral cavity, and these are small red macules. And then mumps. Mumps is an infection of the salivary glands, and it most commonly affects bilateral swelling of the parotid gland. So mumps, you need to think of parotid. And that is viral infections.